Good morning, good morning, good morning. We're a little late getting started, so we're going to roll right into this thing. Thank you for joining the CMO session of the Fall 22 Medicaid Fair. My name is Keena DeWitt. I'm the Senior Manager of Managed Care Compliance at the Georgia Department of Community Health. I'll be facilitating this session with the help of representatives from Gainwell Technologies, Brenda Hewlett, and Darlene Bonner. During this session, you'll hear from all three of Georgia's managed care Medicaid health plans, AmeriGroup, CareSource, and Peach State. They're going to share with you information about behavioral health services that are available to their members, as well as some innovative initiatives that they're working on. Representing AmeriGroup today, we have Monica Lester and Vivian Scott. Representing CareSource, we have Tony Gray and Min Nguyen. And representing Peach State is Brittany Mathis and Remy Rodriguez. After the CMOs have presented, we will allow time for questions, so please hold your questions until the Q&A portion of the session. Those attending virtually will have the opportunity to ask questions as well. So without further delay, we'll begin the CMO presentations, starting with CareSource.
Good morning. Thank you, Mr. Witt, for the introduction. My name is Min Nguyen. I'm the Market Medical Director for Georgia. Nice to meet you all today. Thank you for joining us bright and early in the morning, right? All right, so we get right into it. Let's see. We have some slides from DCA. Should I go through them as well, or just go straight to CareSource? All right, let's see. We'll stroll through CareSource. All right, so CareSource, here we are. To start with, we are the CareSource health plan with the partnerships with Heart. Throughout our presentation, you will hear it over and over. We talk about Heart a lot. As you meet a lot of our CareSource team members, you will see that everyone is just really living the mission of CareSource, serving the members in our communities and state. So our mission, again, is to make a lasting difference in our members' lives by improving the health and well-being. We have about 2.3 million members throughout the country. We are a nonprofit health plan and a national leader in managed care. With 30 years history of serving the low-income populations across multiple states, including Georgia, which we love, Arkansas, Kentucky, Ohio, Indiana, and West Virginia. Our commitment has always been to always put our people, our members, over profit. We serve members across the continuum of government programs, coordinating their care as they are going through the eligibility changes. We have comprehensive and member-centric models of care to address the entire population's health and social needs. I have my partner here, Tony Gray. He will go over the different social services and life services that we provide as well. Our members get a lot of different struggles and barriers as they go through the healthcare needs, and we help them navigate through all of those obstacles. We have local presence and support. Our local teams here have offices in Atlanta and in Savannah. We support our teams and our members with health partner engagement, community education, case management, Job Connect, and life services, as well as utilization management here in Georgia. To highlight some of the different things that we do every day, we also have a focus today on behavioral health services and resources that we'd like to highlight with you all. As you know, through the pandemic, many families and members suffer through many different mental health illnesses. We continue to cover all the different programs that we used to based on the medical necessity of the patient. We continue to have coverage for inpatient needs, psychiatric residential treatment facilities, partial hospitalization, intensive outpatient programs, outpatient treatments, ASD, addiction services. We obviously get into telehealth as that's much needed as people cannot get into the different facilities during the pandemic. Our behavioral health programs is led by our awesome director, Adam Klein, in the audience there that you will meet. We have really awesome, robust programs where we're trying to be creative and progressive and proactive in helping our members, making sure that we bring the needs that they need to them. We have programs such as the Severe Emotional Disturbance Pilot, where we enroll members to help additional needs for the mental health. We have different programs to help with suicide prevention and ER diversion. some highlights for you all as providers. We would love to hear from you all to have any other inputs to how we can best serve our members. But as you can see here, we have different things going on with our website, where we have a My Strength program, where it is a safe and secure tool for our members 13 years and older to sign up to get personalized support to improve their moods, strengthen their health, mind, body, and spirit. We have 24/7 CareSource nurse advice line that you can have our members call. They can get advice and guidance on where to go for their mental health needs. On our website, you can also sign up for different addiction medical services needs with the hotline that someone could call and get advice on where to go. We also have a very robust care coordination or care management team led by our VP of Care Coordination, Ariel Estevez. She's also in our audience today. We have a whole local team here to support our members with specific needs. Members can sign up by calling these numbers that you see here or logging in online as well. In addition to our behavioral health programs, we've been in the community just about every weekend. You will see us everywhere. Our teammates are just living the mission every day, going out there, reaching out to the members and serving them where they live and work and bring the needs to them. We recently, through the pandemic, came up with this idea of having CareSource Care Days in the community. So if you're a provider and you'd like to partner with us, we would love to hear from you, and we'd love to partner with you to help best serve the patients and the members. As you can see here, we have safety first, so we always have personal protective equipment available with our CareSource Care Day events, where we go to the provider's practice. We help reach out to the members, help bring them in, give them rewards and fun-filled activities to make it more fun and exciting. We have a focus on adolescents and kids where they haven't seen a physician in 2 years over the pandemic. So we bring lots of fun-filled activities. We had events over the summer in the past few months where we bring back-to-school supplies, lots of fun, tough stuff to give away, like bubble wands and blow-up microphones, and lots of giveaways to make the kids feel excited to come see their doctor. We engage with the community by bringing in police trucks and fire trucks to get it excited at these events. We have different fun food and things to help make the events more festive for the kids as well. And again, these are all different ideas that we came up with, and we would love to hear more ideas from you all, and whatever we can do to help best serve a member and help support all of you, we would love to hear those as well. Up next, I'm going to hand it over to my partner here, Mr. Tony Gray, to talk about the life services that we provide at CareSource. Thank you for your time.
Good morning, everyone. My name is Tony Gray, Life Services Manager for CareSource. Our team, first and foremost, we're committed to encouraging we're committed to serving the member where they are. Our team is comprised of 4 life coaches who is in our member focus area of life services. They support the member directly, as I stated, where they are. Throughout 4 corridors of the state, we have a caseload of about 50 members each per caseload. We also have an engagement specialist that supports the direct referrals of our life services team. Myself, as well as my director, Jason Anavitarde, serves as the director, and me, of course, the manager in our community-focused area, which supports the CBO relationships, community-based organizations, any partnerships, sponsorships, managing those relationships, and also we have our state housing lead, or our housing SME, Brandy Marinko, who supports our housing needs and services those housing needs. Life Services is our umbrella brand for our life services team. We support our workforce development by having employer partners to support the needs of our members, health equity strategies, providing the resources to our members, housing, as I mentioned. We do have a housing SME who supports the needs and tries to close those care gaps, and food and nutrition, where we support the needs of the community, serving rural areas, so on and so forth, throughout the state to support those needs as well. How do you reach our life services team? We have a no wrong door approach. We service members from 16 and older, those individuals who are in the household. We also service those if they are opted in to life services. You can reach us by emailing us in our life services Georgia email. You can contact our 1-800 number, and our engagement specialist will reach out to you. Thank you, and that concludes our time.
Hi, good morning, everyone. My name is Brittany Mathis with Peach State Health Plan, and we are extremely excited to be back in person this year since the last in-person fair was in 2019. So Peach State Health Plan is one of the 3 care management organizations. We have been present in the state of Georgia since the inception of in 2006. We currently have 668 local employees and serve right over 1 million Medicaid members. Peach State Health Plan's community outreach teams and provider relation teams are local to the communities that we work in and the providers that we serve. So Peach State Health Plan has a very robust community outreach team with various events that take place across the state all days of the week. We have individual and family support and other ongoing initiatives to include like back to school fairs. One of the most recent initiatives or programs that we have are the care packages that we are offering to our members. These care packages have come along with the times that we are in right now and include different types of items as toothpaste, laundry detergent, household items, and toiletries that people need in their homes. We also participate in a lot of back-to-school activities and fairs. We partner with schools, churches, other community-based organizations across the state to ensure that children, have the items they need and are ready to start school. So our holiday give back campaign is about to kick off as we enter the seasons of Thanksgiving and Christmas. Oops. Okay. During the Christmas and Thanksgiving holidays, we do partner with food banks and other organizations to ensure that our communities have the food available they need for these special holidays. As far as education goes to our members, we do have new member meetings that occur monthly in various regions across the state. During these new member orientations, the members are educated on the member website, the app that we have available for them, how to update their PCP, all of the necessary information that our members need to make sure that their healthcare experience is positive. Another neat thing that we do at Peach State is Conversation with Peach State, where we will have a member of our community outreach team sit in either an FQHC, a provider office, a community resource center, to be able to share brochures and information with either our members or maybe potential members who would like to join Peach State Health Plan. For member and provider service call centers, we receive for the member engagement calls about 33,000 calls a month, and we have a quality rating of right at 95%. And for the provider engagement, we do receive a few less calls each month, around 20,400, with a quality rating of 95%. Sorry about that. Also, Peach State Health Plan offers a robust grouping of case management programs for our members to ensure that their health care is being taken care of appropriately, and we are working to keep our members healthy. Some initiatives for prenatal and postpartum care is for expectant moms. There are a couple of different incentives for this. Members who complete their prenatal and visit within 42 days of the notification of pregnancy will receive a $100 gift card that they can use towards, gas, transportation, utilities, things that make it necessary to live these days. We also have a Mom's Meals program for our expectant mothers. The Mom's Meals provides nutritional counseling, and there are 2 meals for 4 weeks. And this is really helpful for our members who have those chronic care conditions like diabetes or high blood pressure and other chronic care conditions. We also throw baby showers quarterly for our mothers, and at those baby showers, the expectant mothers can enter into a drawing to win up to $300 worth of prizes that will be helpful when their new baby arrives. Some other case management programs that we have for prenatal care. So we've had the Start Smart for Your Baby program, but there's an enhancement with a text and email program that has been added to keep our members informed and up to date with what's going on. Also, we have a high-risk OB management program that is managed by our case management department for early detection of high-risk pregnancies. And so at this time, I'm going to turn it over to Remy Rodriguez, and she's going to discuss behavioral health with you. Thank you.
And good morning, everybody. I'm Remy Rodriguez. I'm the Vice President of Behavioral Health Operations for Peach State. Thank you for joining us, and thank you for all the partnership you have shown Peach State throughout the years. I'm going to start talking a little bit about that partnership with our providers. I think during the pandemic, we've all learned that behavioral health has become very important. Mental health issues have increased within the population we serve, and your partnership with Peach State has really stepped up and been able to meet the access needs of our members. We've done that by continuing to grow our network, not only in size, but also in scope and setting. We have, in addition to our traditional providers that we contract within our network, such as community service boards, psychologists, psychiatrists, master's level clinical licensed clinical providers. We've also expanded to other provider types within that network. We've seen more psychiatric nurse practitioners come into our network that are able to expand access to psychiatric services. We've seen our autism network expand by having providers such as speech therapy clinics expand into the autism services to provide integrated care. Our federally qualified healthcare centers have also stepped up and provided access to more behavioral health services. Finally, we've seen a significant increase in school-based care. We contract with over 780 Apex providers that serve in various schools across the state, as well as over 100 school-based clinics that provide integrated care, which includes behavioral health. Our approach to behavioral health is one that is integrated, and we wrap around services to all of our members, having our member be the center. And that means that within the health plan, we look for those members that are high risk and need extra care, and bring the whole multidisciplinary team to provide the care that they need. We also take a systemic approach to providing behavioral health care services, and that includes looking at the social determinants of health of our members. And for that, we have our Care Connections line, where both our internal care management staff and USR providers can call. And when a member has a social need, such as housing, assistance with paying their bills, care, assistance with care, you can call and get assistance for our members. Finally, we look at innovative programs to serve the targeted need to our members. There's certain member populations that require additional support, and this year we've expanded some of our innovative programs to meet those targeted care needs of our members. Starting with Choose Tomorrow, which is a program that identifies members at risk for suicide suicide, that's at risk for suicide, and focuses on assessing their needs and getting them into treatment early. Also, our HALO program that focuses on identifying members that are at risk for substance abuse. We look at all of our population, we stratify it, we outreach to those members, do an assessment, and then refer to treatment. We also have several programs that focus on opioid addiction and preventing opioid addiction, as well as getting members to early treatment. And our MEDS program that focuses on those members that have had care for an extended period of time, but need extra assistance being connected back into the community. Our MEDS care managers reach out to both the providers, so you might get a call from our MEDS care managers, as well as the members, and works with them to develop a care plan that helps them get community resources that might help them transition back into the community from the services they're needing. And finally, we have a new program that we're very excited to tell you about and that you may be hearing from our contracting team about. It's our value-based care purchasing program for our providers. This is a contracting program that looks to enhance payments and bonuses for engaging our members into treatment and obtaining treatment outcomes. So we've begun contracted with value-based care contracts. We thank you for your time, and our team is here and will be able to answer any questions that you have.
Good morning, everyone. My name is Vivian Scott. I'm Director of Provider Experience with Mirror Group. And here with me today is my counterpart, Monica Lester, who's Director of Network Management. We also have a lovely group of leaders and other professionals within our organization here to support you today. And at any time, please come by our table. We look forward to engaging with you and answering questions and assisting you. So I'm going to give you a little bit of information about our organization today and highlight some of the activities we've been engaged with over the past couple of years, and particularly with the public health emergency. Okay, so here is an overview of our organization, and here mentioned is our mission and our value proposition, which at its core serves as a beacon for us for guidance for our purpose and our commitment to serve the members of the Georgia Medicaid population. Also in the green area, there's statistics about our organization here in the state, including the number of years we've been here. We've been one of the original CMOs since inception. We currently serve about 611,000 plus members, and we have over 51,000 providers in our network. One of the activities that our illustrious marketing team has been involved in, led by Maria Enriquez, is an update to your address campaign. And this was launched in last year and intended to encourage members to go out and update their information. You know, as we start to see a relaxation of the PHE, this is going to be more and more critical that we have up-to-date information on members such as demographic, employment, and income. So we have been out in the communities, you know, shouting out and providing this information and encouraging our members. And we also welcome provider collaboration to assist us to get that message out. Serving our communities, again, our marketing team is engaged in thousands of activities throughout each year, and we haven't let this slow us too much during the PHE. We encountered some challenges, but we felt it was important to continue to engage with our communities and with our members. And here listed are just some of the activities that we've conducted throughout the years. One of the things not highlighted here that I do want to mention is AmeriGroup is extremely proud that we opened our very first community service center in Southwest Atlanta. And this center will allow visitors to access a multitude of resources and information around such things as access to care, employment, social, and financial assistance. So if you haven't come around and been able to see that, please come down. We are near the Greenbrier Mall area, and we would love for you to come by and take a look at our center and what we have available for our community. Our Georgia Families 360 program, which is led by Bhavini Solanki, serves as one of the things that we are most proud and privileged of, and that's to be able to serve the very vulnerable population of children and adolescents and their families that are in the foster care, adoptive assistance, and those wards of the state through the Department of DJJ. One of the things that we wanted to highlight here is a recent program that we've launched called GOMO. It's an autism support program. And what it does is it uses technology such as text messaging and chat to offer 2 levels of both early detection and managing the diagnosis of autism. It provides support to both the caregiver and the child. And here you'll see the statistics that we've been experiencing since the launch of the program around those 2 levels that we offer enhanced services for. The program currently is managing a little over 31,000 members, and we want to remind providers of a value-based incentive program that is very near to the core of supporting this population that we call the 10-10-15. And it's a program for participating providers in our network who are rendering these needy services and delivering them consistently and at a high level of quality. And we offer an incentive that we identify through our claims processing activities. So there's nothing for the provider to do if they are providing care to our members and they continue to engage and help us with providing these services, then they will receive that incentive automatically each quarter. In our Georgia Families program, we wanted to highlight some other initiatives that we've launched over the past couple of years, and we've had a multitude of programs that we're very, very proud of and have been quite successful. Mom's Meals, which was launched in September. For diabetic moms, we've served about 211 moms since the launch of that program. Care, which is a remote monitoring program for diabetes. The Virtual Nurse Online, which is a program that allows us access into hospital EMR systems and really assist our utilization management and care coordinators to be able to more quickly identify needed information that may be helpful in us being able to make determinations quicker around prior authorization and continued stay. And then our doula pilot for high-risk moms. This is a more recently launched program in April that we are doing in a partnership with another large community-based organization. And then lastly, our Mom Heart Matters program, which is a pilot with Liberty Regional Medical Center in rural Georgia. Behavioral health services initiatives that are listed here, we've had a lot of engagements with different partners within the community to help us to improve mental health and access to care. Our behavioral health services is led by Lakeisha Williams, and her team does a fantastic job at partnering with our providers in our network to help us to better serve our membership. Here listed are some of the initiatives that we've launched over the past couple of years. Our collaborative with both Peachford and Viewpoint on a health priority access for appointments. Hillside, we have an intensive in-home project. and suicide prevention and intervention model, as well as the psychological testing fast track process that we hope has created an admin simplification for psychologists to be able to go out and obtain free 6 units up front to be able to render those services and to get that quality of care assessment for those members more quickly. Our quality management team is led by Danielle Lauer, and we wanted to just highlight some of the activities that they are engaged in very actively throughout the year. HEDIS activities, which we could not do without the support and collaborations of our providers. It's a year-round process. It helps us to collect a lot of needed data, and it also helps us to understand our performance in the organization. As well as what we need to do to improve in our care to our members. And then our CAPS, our consumer, provider and systems activity that really enhances, at the end of the day, the relationship between the patient and the provider. And again, we conduct surveys with both members and providers to just understand how our members are perceiving the care they're receiving and what we can do to partner with providers to better improve that care. Lastly, we want to give you a little bit of information on how to contact us. Our provider web portal, which you can access at the link listed here, has a wealth of information of contacts and phone numbers and emails and links to various access points within our organization. And if you are interested in joining our network, we also have a link that is included there. If you go to our provider portal and just type "contact us" in the search function, you will be taken to a link that will give you an access to all of the information you see here. This concludes our presentation today. On behalf of our illustrious Plan President, Mel Lindsay, and the entire Amira Group leadership team, I thank you for your time and attention today and wish you all a great day.
Thank you, everyone. Keena DeWitt is going to give us she's going to wrap it up for us. But before that, I just want to let you know we are going to be opening it up for Q&A, but if you have to leave before the end of the session, please fill out the survey form. And for those of attending virtually, you will also have an opportunity to fill out a survey form. Thank you.
Thanks, Brenda. Thank you to CareSource, Peach State, and Amira Group. As a reminder, each CMO has a vendor table here. They also have a table for claims information, so if you would like to speak to someone one-on-one, I would encourage you to take advantage of that opportunity. The presentations may have prompted some questions for you, so we're going to go ahead and take some time now to answer your questions. However, we're going to begin with questions that were previously submitted during the registration process. Then we're going to rotate back and forth between questions from in-person participants and then those that are participating virtually. When you're asking your questions, please let us know who your question is intended for. If it's for one CMO, if it's for all three, or Gainwell or DCH, let us know that. In-person participants, we're going to ask that you make your way to a microphone, and for those that are participating virtually, you can go ahead and open the Q&A panel and type your question in there. While you're doing that, we're going to go over the questions that were previously submitted. The first question is, are there any restrictions on the policies and code edits for CMOs? Are they required to follow Georgia Medicaid and allowed to create their own? The answer to that is the CMOs at a minimum must provide the same services to their members that are available via fee-for-service. The CMOs also provide many value-added benefits that are not offered to fee-for-service members. CMOs' fee schedules differ, and their reimbursement for services may vary from fee-for-service. Providers are advised to reach out to their CMO provider rep and to refer to their signed contract. Update on POS 10 usage and rejection of diagnosis F43.8. POS has been added to the system to use as appropriate as of April 2022. Diagnosis code F43.8 is not reimbursable as there are more specific codes that can be used and will therefore deny. We have several sites, several NPIs. Is it possible to use one universal NPI number for our company? The decision to use one or multiple NPIs for each location is the business's decision. If you wish to update your NPI number, the NPI information can be updated via the MMS web portal. You would need to submit the online change of information form. And to access the online change of information form, you must log into the Georgia Medicaid Management Information System, GAMIS. And that is at www.mmis.georgia.gov. Use your username and password. The online change of information form is located under the provider's link. Who can you reach out to when you are not getting a reply by email on a repeated rejected claim that you sent an email up for help? Providers should always attempt first to resolve the issues with the CMO through their provider rep. If attempts to resolve through the CMO have not been successful, the provider may contact the DCH Contract Compliance and Resolution Unit, which is my unit, at mgdc.complaints@dch.ga.gov. Why is HE modifiers not accepted by Medicaid? Home is covered and nursing home is covered, but assisted living isn't covered. The HE modifier is not covered for the emergency ambulance program. If a member needs to be transported from an assisted living facility, the R, residential modifier, would be the appropriate modifier. Assisted living is covered for ambulance services. It's the member residence, therefore the R modifier will cover the assisted living. Changes for telehealth services. CareSource has no rates or contract amendments. However, routine fee schedule updates were made, including those reflected in the telemedicine manual. Peach State Health Plan follows DCH guidelines for telehealth services and will continue. AmeriGroup is in alignment with DCH, the GAMIS Telemedicine Guidance Manual. Coding with CMOs compared to Medicaid. Often CMOs don't use the same modifier or sequencing and billing as Medicaid. Need regulation for this. CareSource follows the industry standard coding guidelines, including appropriate use for modifier. NCCI and MUE edits are examples of the rules in place to enforce appropriate billing guidelines. Our Quality Enhancer value-based reimbursement program is an exception to this rule. Providers are advised to use designated modifiers to serve as reimbursement triggers for target quality measures. Peach State Health Plan follows Medicaid billing guidelines. For AmeriGroup, CMOs are permitted to have proprietary fees and coding rules if they do not conflict with NCCI or regulatory requirements. How to recognize the payment for services and the month for the payment. CareSource's response to this is the provider EOP is dated and would indicate which services are paid along with the corresponding amounts. Denial codes and explanations would be indicated for unreimbursed services. Peach State Health Plan's EOBs have the process date in the top right-hand corner. For AmeriGroup, on the provider's EOP, the payment for services is captured in the total net paid and net paid fields. The month for the payment is captured in the check/EFDT field. And that concludes the questions that were previously submitted. And so we're going to start with, let's do some in-person.
Right here, this is the first person I saw. So what we're going to do is take one from the in-person here, and then we'll have one read out from the virtual.
Good morning. I wanted to bring up an issue that was originally brought up by a representative from Piedmont Healthcare System in 2019 when we were last all together regarding credentialing. We were told then that the 7400 file was transmitted once a month. However, that is actually incorrect. When we are credentialing our providers through the GAMIS website, that data file, as soon as the provider's enrolled, is there, and we're needing all of the CMOs to be able to access that file immediately. From Peach State, I get, it might be 30 to 45 days to upload your provider. AmeriGroup, who knows? I credentialed 4 providers this summer. I have an effective date for 1, and this is November. CareSource, thank you very much. I have letters for all 4 providers with an effective date, very much appreciated. And the day one of my providers was showing up enrolled between 8 and 9 o'clock in the morning, that afternoon, I emailed my provider rep for CareSource at 1:22. At 3:48, she had an effective date. That tells us that data file is there. Please communicate to your programmers to ping and access that data file and upload our providers. I serve children, PT, OT, speech. I have a waiting list a mile long. I've hired more providers, but they can't see your members until you upload my providers. Please help us with that. That is a nightmare for everyone that has to be credentialed, trying to get them where we can bill. Take a look at your bank account. Did your paycheck go in this month? If I have to wait 40 days for someone to be in the system, that holds the paycheck. For them, for me, I have to pay them. That is very, very difficult. And I would appreciate your help with that. Thank you.
Want to have a comment from any of the CMOs regarding that, a follow-up? Well, CareSource, of course, they want to talk about it, but yeah, go ahead.
No, thank you for bringing up that concern, and I appreciate you bringing that up. I am the co-chair of our credentialing committee, and if I get that alert at 9 p.m. last night, I wake up at 4 a.m. this morning to sign off on it, and we try to do that every single day. And my partner, well, my boss really, Dr. Sukas, is in the audience. She would help sign up and sign in and log in and sign off on those as soon as we can, so I appreciate you complimenting us, but that's important so we understand where you're coming from.
Thank you, CareSource. We're gonna see if they have follow-up comments, and then we're gonna go to a question from virtual.
Yes, thank you. So for AmeriGroup, first of all, to address the information, no, we do receive the file daily when it comes over from the state. What may cause a little bit of a lag is when we receive a particular provider on the file. We do have a contractual requirement of a time frame of when we must have those providers loaded. So what I will say is if you will get with us so that we can get a little bit more information about what you've been encountering. Thank you.
Hey, good morning. Peach State, we, of course, receive the file daily as well, and we do have a table with our reps upstairs, and if you would bring the names of those people to us, we will see about getting those loaded, and I apologize for any issues that you've experienced. Thank you for looking after our members.
Thank you. We're going to go to a virtual question now.
So the first question is, can the CMO speak on how their organizations have been engaging with DCH regarding provider enrollment efforts?
It sounds like that's kind of what we just, is that familiar, was that what we were just covered, or is that something different?
They want to know how they get in contact.
Yeah, they want to know how to get in contact.
When they're having issues with the 745.
Okay, so they want to hear from each CMO. Is that right?
Yes.
Okay, please.
You talking about this question right here?
So from CareSource standpoint, we have the Georgia Provider Relations at caresource.com. If you have any specific questions, we'd love to work with you on that. But obviously, at any given time, we're always working with DCH on different initiatives. We meet with them monthly on different things to report out on all kinds of qualities, to engagement, to initiatives that we have going on. So if there's any specific question, we'd love to address them. Does that help? Yeah?
Same as CareSource, we engage with DCH monthly in various meetings. In terms of enrollment questions, is your provider loaded? We have the contact list of the provider relations reps that's posted on the AmeriGroup website.
Same as the other CMOs, we engage with DCH frequently, and we have a territory list that is out on our website, so you can find your assigned provider rep. It also includes the managers, directors, and vice presidents' information on our territory list. We have some upstairs at our table, and we will be happy to help you today. Thank you.
Thank you. We'll take one from here in the audience.
This is a question for DCH. We have been, I'm with a small primary care clinic. We have credentialed providers, but we have not contracted yet with any of the CMOs. And the major hurdle seems to be, we've been told we have to have 24/7 contact service. I believe each of the CMOs also has 24/7 nurse advice line. So is our information correct, or is one of those not true?
I don't have an answer for you on that right now, but see me afterwards. I'll get more information from you, and then I'll find out who in DCH can get that answer for you. Okay. All right.
Thank you. We'll take one from virtual.
We have someone, my question is about the CMO claims being reprocessed after, for example, a DMA consent form has been attached.
Did they specify which CMO, or they want all three?
All.
Okay.
Yeah.
Okay.
CareSource, go ahead.
I see the confusion and look on everyone's face too. I think we need a little bit more information, but we obviously have our claims and payment cycle team outside here that we'd love to address that with specifics. Does that help? Okay. Everyone's in agreement, so I answer for everybody. Thank you.
That's one of those questions. It's really more. It's easily to answer once you have an actual claim to look at, and when we're talking in generalities, it can be difficult. I understand. Okay. I know that I saw someone up here that had. Oh, that was a virtual. So, is there anybody over here? I've taken a few from this section. Okay, so that's going to be a question at the table. Any other general questions? Yes.
This is directed to DCH. It's regarding some procedure codes. I'm Ruth Ellen Roberts. I own a small practice in Walton County. I'm a speech-language pathologist. The first one is regarding audiology services. We see children that possibly have an auditory processing disorder, but when we try to refer to the audiologist, because they're the ones that are supposed to determine that, they tell us that they can't see the child because there's no code for auditory processing. And when I pulled up the procedure codes, indeed there is not a code. 92620 is for testing for auditory processing, and there's no code exists. So basically, some of the children are not getting possibly the correct procedures applied for therapy because we cannot get a correct diagnosis. The other procedure code is for speech-language pathology, which is 92551, which is a pure tone hearing screening. That is no longer part of our procedure codes. Peach State and AmeriGroup require that a child pass a hearing screening in order to get the full visits. Most of the time, the physician's office will not test a child unless they're 4 for the pure tone hearing screening. So we're, as practitioners, having to do double work because we're having to wait on an audiologist to test a child. And as we all well know, audiologists are rare birds in the state of Georgia, and especially the ones that even take Medicaid. So those are how do we get those codes back in our manuals, and how often do they meet to determine procedure codes? Thank you.
Okay. Do we have anyone from DCH Policy who can answer that here today? Okay. That's going to be a policy question. So I believe, Brenta, we're going to have some notebooks and things that people can write their questions in.
Yes. Any questions that are asked today, if we're not able to answer them, they will be part of the FAQs that will be out on the website within 2 weeks.
So we'll have someone from DCH Policy answer that for you.
And there might be someone here, just not in this room today,
Right.
that we can can get that answered today.
Right. Let's take a virtual question.
Okay. Will CareSource and AmeriGroup have a process to correct or resubmit claims on the portal anytime soon?
Hi, this is Dr. Nguyen from CareSource. We do have a process in place. Please allow me to confirm the actual dates and time and things, and I will get back to you on that. Yeah.
For AmeriGroup, you can submit corrected claims, request payment reconsiderations through Availity.
Okay, thank you. Any other questions from the room here in person? Yes, ma'am. Oh, she's got.
I finally get to use my mic. Good morning. The question is, or request is for DCH. We come here as providers and we get full attention to all our CMOs, DCH, provider reps. When we're back at our offices, we struggle to get anybody to help us. Is there something in place that we can do, a monthly town hall meeting or something virtually that we can, air our grievances? Like, for an example, it was a couple months ago that we were on a virtual call and we were promised, and all of the provider reps said, we get back to our providers within 72 hours. Not true. Not true at all. I did take your email address that we can address these problems, but we, as providers, we have these problems like that woman said. Is there something we can do monthly that we could log on if we do have problems, or do we have to wait another year to come back here? Good question.
Well, first of all, thank you for bringing that to our attention while the CMOs are here, can hear that in person from you. We don't currently have any formal monthly process in place with the providers for that. I'm glad that you do have the email address and you can email us. You and I can have a conversation. You can touch base with me after and we can speak a little bit further about that and kind of see, talk more about your suggestion. Thank you. All right, virtual question.
This is for Peach State. Does Peach State have an update on the claim issue for lab services being denied for missing CLIA number? While the CLIA number was submitted on the claim form, we currently have 200 to 300 current data service denied in error that have to be submitted reconsiderations for. We have to submit reconsiderations for.
So that was for Peach State. Yeah. Can you state the first part of that again?
Does Peach State have an update on the claim issue for lab services being denied for missing CLIA number? Clea? Oh.
So we have our claims team upstairs that we will ask that question to, and then we will get back to you for the full FAQ document that you'll be sending out.
Thank you. Any questions in the room? Here we go.
Thanks. I have a second one carryover from 2019. It has to do with secondary claims payments. Many of us were at the secondary claims table with the AmeriGroup at the time. We were told we were aware of the problem, we're going to fix it. What is happening is we have commercial insurances paying primary and Medicaid is secondary, and we're not getting the payment up to the Medicaid allowable. All three of you have in your manuals that the state manual supersedes whatever your coordination of benefits paragraphs say. And the Medicaid manual says, any items or services for which other insurance carriers' reimbursement amount is equal to or greater than the Medicaid maximum allowable amount will be paid at zero. However, when the payment from another insurance carrier is less than the Medicaid maximum allowable amount, Medicaid can pay up to the Medicaid maximum allowable amount. I humbly request, please pay up to the maximum Medicaid allowable. In 2019, it was just AmeriGroup. Now it's all three. Again, this is our paychecks. We are trying to serve your members. Our money is very tight. Those of us in this room, we're proud to be standing tall, that we're still in business coming through the pandemic. And last year, all three of you had over $1 million profit.
Thanks for that question. Did any of the CMOs have a specific comment in regard to these TPL claims?
Okay. So yes, ma'am, our manual does indicate that. If you have some examples that you can provide to me so we can check into it and see what's going on, we will be upstairs after the session. Thank you.
Thank you. You're always bringing up some really good questions and ideas for us. And as you know, we're a nonprofit organization, and we're all about serving all of you and our members. So please allow us the opportunity to work with you. We'd love to see if we can work it out and make it better for all of you. So thank you.
And for AmeriGroup, similarly, we do have coordination of benefits rules that are published in our provider manual, but there are different uniqueness that may be impacting the results you're seeing, so we'd certainly like to see you. Thank you.
It is 9:58, so we're going to take one more question and see where we're at from virtual.
For a FQHC, why are the COVID tests being recouped back from 2020? FQHC.
I'm sorry, I think I
didn't state for any CMOs
Okay.
for that one.
So it was specific to FQHC?
Yes.
Okay. Could you read that question one more time?
Why are the COVID tests being recouped back from 2020 for FQHC?
COVID claims being recouped, but it doesn't seem like anyone, again, unfortunately, it sounds
I can go to another question.
a specific claim. Go ahead.
Can they contact each CMO directly with an example?
Okay, each CMO, if it's not for all three, then if each CMO could be contacted with an example, that would be very helpful.
She said it is for all CMOs. Yeah.
For AmeriGroup, we're not aware of any recoupment specific to FQHCs around COVID codes.
If you couldn't hear that, the answer was from AmeriGroup, and it sounds like I can tell from their faces that is it's the case for all three CMOs. They're not aware, so it would, again, be looking at a specific example.
Okay. So that's our time for today. If you have additional questions, we have a notebook that'll be going around, and you can write your question there, and then the answers will be posted on the GAMIS website. We thank you very much for attending the CMO update session today and hearing about the CMOs and the great services and initiatives that they have available to Georgia's Medicaid managed care population. Please do take advantage of the CMO vendor tables and the claims information tables so that you can speak with someone one-on-one to get more information and to ask further questions. And we look forward to seeing you again in the spring. Thank you.